I happened to be walking through my own dental office the other day and I noticed a case. Actually, this is one that my associate's doing, but it's a great service that we have here at the laboratory and probably doesn't get talked about often enough. And that's our design services, or our clinical support services, the illustrated product design. And it actually comes on the model as well. For any time you're planning, in this case, a partial denture, and that's mostly what it's for, or combination cases where we're going to have a couple crowns and bridges in addition to the partial denture. And it's really difficult. Most of us can't remember, say, the Kennedy classifications since we took state boards or national boards. I don't even remember what boards that was on, to be honest. And, you know, we don't really need to know that to be successful dentists. And that's what our people here at the lab know, is all those classifications and the names of everything and basically telling us what to do. So if you look, for example, we've got a pretty typical scenario here with the patient's missing molars bilaterally. And they've given us some suggestions about making this a more successful case. You know, we need a couple clinically prepared rests right here in between the two bicuspids. So we need a distal one in the first bi and a mesial one in the second bi. And then we need just one over here. We don't need two. There's no need to do two rests if one rest is going to be good enough. And they tell us they're going to put a couple Akers clasps and they want some clinically prepared grooves for retention. I actually like the term clinically prepared undercut for retention a little bit better, and I'll show you what that's going to look like on the model in just a second as we do that. And so just by giving a little advice here on the paper and showing the doctor where the major and minor connectors and the clasps are going to be, it helps kind of demystify things a little bit. So let me move this and we'll take a look at that model. Pretty straightforward. But you'd be surprised how many dentists take an impression, send it in, and then we'll send them back the custom tray. Hopefully you're using a custom tray for a case like this. And then they will just take another impression in the custom tray and send it back without really having done any rest prep. So letting us show you where the rest prep should be is a good idea. Now, I know a lot of dentists were taught to use round burrs, for example, to make these rest preps, but we do see that they tend to come back kind of underprepared when a round burr is used. They'll be prepared enough, for example, in the middle of the rest prep, but typically there'll be a lip right here. If you can imagine a round burr being pushed straight down into this tooth, at the deepest portion we're going to have enough reduction, but then on the edge towards the mesial portion of the tooth we probably won't. So it's probably better to use something like a 57 burr, but something that's rounded on the internal. So you could use something like that amalgam burr, that 257 we talked about, or even maybe a 1557. It doesn't need to be too rounded on the internal, certainly not as round as a round burr. But a fissure burr is a good way to go in and just prepare something that's going to have adequate thickness. If it's really thin here, we're not going to have enough strength on that metal for it to keep from breaking off. And we don't want the lab to build it thick enough so that it won't break. And now we have an occlusal problem when the patient bites down because those rests are too thick. So we'd like to keep it within enamel, of course. If we expose some dentin, I will typically continue and go a little bit deeper and then place composite over that dentin. I would rather have composite exposed to the oral environment than the dentin, obviously. Not a good idea to leave dentin unexposed like that, but I prefer to keep it within the enamel if possible. And then, of course, just carry that out with the fissure burr to the lingual so that minor connector is going to be able to go and fit up there. When you look at the palatal the major connector, you can see that this is large enough and comes anterior enough forwards where that's going to help keep the distal portions of this from rotating up. And as you'll see on the lower one, we actually have an indirect retainer, a couple of rest preps. And there might be a time where you would see, hey, that we need a rest prep here, or even on the cuspid. You could have a rest prep on the two cuspids or the two laterals with two little arms that come forward to help keep this from rotating forward when the patient chews on something sticky, for example. But here the designers feel that this strap is going to be wide enough and comes far enough anteriorly where that's not going to be an issue. You can see the patient's also got a diastema. That probably played a small role here. We want to keep metal, kind of away from the anterior anytime a patient's got a diastema, because you might be able to see that metal in there and that'll make it kind of a failure as well. And as I mentioned, they also said they wanted a clinically prepared groove for retention, and they show where those are on the bicuspids. And so when you take a look at the model, you can see the little arrow, and they've drawn a portion of the clasp in, and they're saying here is where we'd like a clinically prepared groove. Now, as I mentioned, they call it a groove, but it's really not a groove not the way we traditionally use that term in dentistry. When I think of a groove, I think of a proximal box, for in dental school at least, like an amalgam, or even for a composite, and we're going to put some grooves in there. Or I think of grooves as something we might do with an 1170 burr and a crown prep on the buccal and lingual for anti-rotational purposes, where we're actually taking a burr and going and actually making a groove right into the tooth. Really what we're just trying to do here is create some undercut for that clasp to get stuck in. So you can take a small round burr. A number 2 might be a little small. A number 4 might be a little bit better. You could almost use a pointed burr, really almost anything you want, just to go in and remove a little tooth structure here. We're just trying to create some undercut. So when this Acres clasp comes around, it's going to sit in that undercut and help retain it in place. Anytime they survey these models and see that there's not adequate undercut, they're going to ask that you go in and remove a little tooth structure. And again, we're not looking for a groove, like this clasp is going to fit into this groove and we want it to snap into place in that groove. We're just looking to create some undercut for them so they can tuck the tip of that in there, not make it too apparent, when viewed from the facial when the patient smiles, but have enough undercut in here where it's going to help hold that in place and be part of the retention system to keep this partial from being dislodged. And then the same thing on the other side. Pretty typical on these bicuspids that they'll want us to develop some additional undercut here on the facial or the mesial facial for them to be able to tuck the tip of that Acres clasp into that space and know that it's going to hold well and we're not going to have to worry about retention in that area. Again, this is a pretty simple, straightforward case. Patient just missing lower molars. And the same type of thing that we're going to see here where they want us to do some occlusal rests and they want some clinically prepared grooves or undercuts, as I like to call it, on one of the teeth over here, and then some dimple rests on the anterior teeth. This is probably easier to see on the model, so we'll take a look at that model. So on this one, you can see that we just have 2 occlusal rests that need to be done. We've got a rotated tooth over here, and so you can see that we're still going to put the rest in the same place. We're still going to put it into the mesial pit, up and over the mesial marginal ridge. But because the tooth is rotated clockwise, we're able to put it in that place and not have to worry about that lingual extension. The minor connector is going to come right up and go into that. As you might expect, because the tooth is rotated, we have a little bulge here at the distal marginal ridge. And if you look at what they wrote on the planning sheet, it actually says reduce. And so if we look at the model again, you can see where they want the doctor to come in and reduce it right there where that red line is. And so this is an area, because of that rotation, where we have too much undercut. It really is too bulbous in that area. And so to have something that's going to fit nice and tight down here, like the arm of that Acres clasp, it's going to be difficult to get out of there with that much undercut. And so again, we're going to come in here with something and just remove part of that. That's funny, because usually if this tooth was rotated correctly, that would be facing to the back, and that probably wouldn't be a major issue. So they're going to have us go in and recontour that. That's something that probably would not have occurred to most dentists because we wouldn't have put it on a surveyor ourselves. You can see over here on this side we have an occlusal rest just on that one tooth, not the other one. And this one they've actually prepared a little bit. They don't usually typically go in and prepare all of them unless it's out of the ordinary. And this one they just wanted to prepare and then colored in with red to make the point that, hey, when you put this rest in, make sure it's nice and open to the lingual here so we can get this minor connector up here. This is a different situation than if we had a rest preparation here and here, where you could just carry it up interproximally and then put our 2 rests here. Because we're just doing this one tooth, we want to make sure that this is open to the lingual. You can see the extent of the red ink over here showing you that this rest really does need to be opened up to the lingual so that minor connector can get up there. And of course, because of the size, as almost always happens, of the major connector down here, there's not a lot of area, and because of the vertical surface of the tissue back here, there's not a lot of area for sticky foods. When they lift up on the back of this partial, it's going to want to rotate forward. And that's the reason for these 2 dimple rests that you see here. And really all we need to do on these dimple rests is prepare something that's perpendicular to the long axis of the tooth. So you could take a 55 or a 56 burr and just come in and prepare a little shelf almost, if you will, in the enamel. You can see the sloping surface of those teeth, I mean, it continually slopes down. We just need a flat step somewhere that's prepared. So we're going to come in and make that little flat step right there so that when the metal engages that, it can't go any further. It literally can't go any further because of that vertical surface that we have on both of our cuspids there. I've seen dentists do like chevron rest preps where it kind of goes like that. But I'm just a fan of a simple, that's all I want is a dimple. They just want a flat spot right there, a plateau, if you will, that's going to be perpendicular to the long axis of the tooth so that when the metal hits it, there's a solid contact and it can't slide. So when the posterior segments, the free ends of the partial want to lift up and it tries to rotate forward, we have solid contact between the metal and that flat spot on the tooth so that it can't rotate or slide down at all when those minor connectors go up onto those two rest preps. So we've got the dimple rest preps there. And again, over here, they're going to have us go ahead and prepare a little undercut here. You can see the survey line and where they've drawn in the clasp. And again, we just want to create some undercut there where we don't have a lot of undercut now, just so we've got an area for that Acres clasp to really make some significant contact with and really resist being lifted out by anything, including the patient. You know, we want something that's tight enough where they go to pop it out. They're going to have to work a little bit, and we don't want something that's going to shift around, obviously, while they're chewing as well. Over on the other side, we have enough undercut so that we don't need to do that. In fact, you might recall we have too much undercut, and that's why we're going to come in and actually remove a little of the tooth structure that's there. So it's a pretty straightforward partial case when you look at it. You know, it's very typical. We're missing all the molars and everything else is there in place and is periodontally sound. A few teeth need some other work done on them. But a good example of how the design service team can go in there and show you exactly what to do, because if a dentist just took two final impressions without making any of those rest preparations or modifications, is there a chance those two partials would work? Yeah, there's a chance they would work, but they'd also, without these rests, without the room for them when the patient bites together, we'd have a lot of settling into the tissue and we'd have some retentive issues. Just these few little modifications that you're being asked to make oftentimes makes the difference between success and failure with a partial denture case.